We look at the condition of the child, the age of the parents, is the agency approved by CARA? That's of great importance. So when we assess these babies, what are we looking at? Nutrition, like I told you, is this an overweight baby, is an underweight baby? How is the hygiene aspects? The physical examination is crucial, head to toe examination. So that we're all trained to do, and we give more importance to these babies, spend a lot of time, because that will, it has a lot of long-term implications. Even if we miss a heart murmur, then we're in trouble. So we focus on the presence of or absence of congenital anomalies, and we look at the developmental milestones. Okay? So the general information, that is for the record keeping. For the medical report, we need the date and year and the sex of the baby, the height, weight, head circumference, and the institutional details are very, very important. Like she said, most of the time, it's not very transparent, so we have to try and source it, because all that is of crucial importance. If the baby did not cry at birth, for example, what are the long-term implications? Was this baby asphyxiated at birth? Was it a blue baby? Was it deprived of any oxygenation at birth? Which means that there can be long-term repercussions in terms of development. And if it's a 1 month or 2 month old baby that they're going to adopt, the parents may not know. But we will know if we have the birth details, and then we can guide the parents. These problems can occur later. There can be developmental delay, etc. So where was the child staying? Was it staying at the center with relatives and private care? And what about the past diseases? Were there any contagious diseases? And the vaccine schedule. What all vaccinations? Usually the adoption centers, I think they do only the basic vaccines. None of these extra vaccination is done there. The main vaccines are done at the centers. And then we look at the mental development and the behavior and the skill set of the child. So development has 4 aspects: the visual, the hearing and speech, motor, which is gross and fine, and social skills. So all of this has to be looked at in detail. Earlier it was the other way around. They would bring the kid and we would assess, and then we would give the green signal, then they would go ahead with the process. So this child was about 2 years old, was not talking, was barely walking, and was looking very depressed. And so I had to guide them. I had to give a cautious recommendation. I gave them the exact truth of where this child lay in terms of development, where that there was a delay and that there was depression, etc. But this mother was very, very bright, and she was like, I think I can take on this challenge, doctor, and I'm going to take this baby home. So we said, the baby is probably going to be fine, and we are going to guide you through, and we also offered the experts to give their comments, like physiotherapists, like psychiatrists, they're all there. So we can seek the help of the entire paramedics and then give them a proper impression. But she was like, I will take this baby home. And in 6 months' time, just exactly like she predicted, this kid was walking, talking, was amazingly extroverted child, if I may call it. I mean, it was just the environment changed that did a world of good. So after that, I got a lot of confidence. Whenever I counseled them a little more positively compared to the first time, and I was very cautious, and I was worried myself, when I saw this child. And then like I said, the head-to-toe examination. And then we look for any diseases, like these kids come from all social strata. So we have to look for tuberculosis, for HIV, for hepatitis B, hepatitis C, syphilis, etc. So we do a stool urine test, and like I said, most of these kids, they are fed well in these adoption centers. I mean, people give them food on time, and that the IMRs are all doing very well. But there is no mental input. Most of the time they're given food and they're made to sleep, and clockwork. So they grow well, but mentally they're almost, a lot of them are very delayed, and there is a lot of depression in some of them. There's no stimulus, mental stimulus. So we have to look for that, and for the behavior. This autism is another thing which can get missed. I mean, the early stage is very, very difficult to identify. So at 6 months itself, we get a clue. If they're 3 months, there's no way you can identify that. So how is this child, that's what, so the mental aspect, like as much as importance should be given to the physical aspect, I think the same amount of importance is we given in assessing the mental aspect also and the developmental aspect. How is this baby in contact with other adults? How is this child behaving with other kids? How is it vocalizing? What are the language development? How is the baby, baby developmentally appropriate according to age? So the basic test that is offered will be the screening for liver, the complete blood count, the liver function test, the renal function test, the thyroid screening, the torch, the hepatitis screening, and the HIV, and the urine screening for inborn errors of metabolism. And further, the luxury tests, as they call it, will be the additional tests, which is the ECG, the echo, the ultrasound abdomen, and the X-ray test. Okay, these are all the ones which are done usually. And then for HIV, more specialized tests, if they're positive for the antibodies, ELISA antibodies, then at 9 and 18 months, a follow-through is required with more confirmatory tests. Similarly, for the hepatitis C virus. And then for the neonates, I think we also look at the what's called OAE, autoacoustic emission, and the BERA. These are the hearing tests. Some of these kids have colds, and unfortunately, they fail their hearing tests. And people actually don't take these kids for adoption. But we do advise the parents to wait it out, wait for 2-3 months and repeat the hearing test. And they actually pass it 9 out of 10 because the colds cause conductive hearing loss and most of these babies fail it. And then people reject them thinking they have a hearing problem, but actually that's not the case. So again, those are the instances where we can guide the parents through and say this may not be a permanent one, it may not be a sensory one, it's just a conductive hearing loss and it's going to get better with time. So again, I think we already mentioned these tests. There are rarer diseases like sickle cell anemia, hemoglobin S, thalassemia, etc., which we screen for depending on where the baby comes from geographically, etc.